I teach at Calvert School and also am a RN, so I actually practice nursing in the summer. And in the 9 months of the school year, I am at Calvert School in admissions and teaching in the afternoon. When I laugh and play with my puppy, I use 4 senses. Can you all help me think of those 4 senses? It began that I was having some serious painful episodes at home, excruciating pain that I just didn't know how to manage it. Nothing I tried brought relief. And I touch. So this particular night, I woke my husband up and said, I need to go to the emergency room. Something is just not right. See it when you're going down the street. At the first emergency room, I was told that I possibly had passed a kidney stone. And they released me, and upon returning home, it wasn't shortly thereafter that the pain returned, and I knew that that was not the case. And this led me to St. Joe's, and they were able to see me within an hour of my coming through the front door.
I saw Monica Stewart shortly after her admission. She initially presented with flank pain and severe migraine headaches. She had recently been to another emergency room in the city, and so this was her second emergency room visit within a very short period of time.
They worked me up immediately, had me become more comfortable with IVs and pain medication, and with a variety of diagnostic tests, it was noted that I had a mass in my spleen.
Due to the flank and abdominal pain, she did get a CAT scan, which is an imaging study of the abdomen, and was found to have a large tumor in the spleen. We were obviously very concerned about that.
It was very frightening, given the fact that my daughter had just graduated from high school. We were coming off of a high point, being excited about her going off to college, and for me to think that the possibility of having a mass in my spleen was unsettling. Dr. Mackey was sent to me because this was his area of expertise. I was very impressed with him as an individual. I liked the fact that his youthfulness made me feel that he was cutting edge, that he knew the research, he knew the literature, he knew the latest in the area of the spleen. And of course, I did my own research at home. That's just my nature. I just love the fact that he recognized in me that I like detail, so he gave me detail. He met me where I was, which allowed me to be much calmer and to just rely on my faith and rely on his skill and his ability as a surgeon to do what I thought he could do. That are native to the country. I felt that he would be the kind of physician that I could connect with. And his personality and just his demeanor suited my personality quite well. We were able to talk in a very specific and direct type of way. And he put my mind at ease by also giving me the reality of what we had in front of us. He explained to me that there are typically 2 ways in which to remove the spleen. One would be laparoscopically, or one would be with an open incision. He explained to me that he was choosing the laparoscopic method and why, and that it would give him the option to use the open procedure if he needed to.
This tumor was only approximately 5 centimeters in size, so removing it through a laparoscopic approach was reasonable.
Dr. Mackey was just wonderful. I mean, on top of the fact that I thought his office was very welcoming, his staff was lovely, and the punctuality of our visits whenever we came, it wasn't like I had to wait behind other people. He was able to see me in a timely fashion, and I got the impression that that's how they do things. This was not just an accommodation for me, but this is how his practice flows. So when I got in to see Dr. Mackey and we talked, I could completely be in agreement with the approach that he had for the surgery that I was going to have.
Once we had ruled out that she had any additional sites of disease, we proceeded with a splenectomy. We were able to achieve that laparoscopically, which made her recovery much quicker. I believe she was in the hospital for 2 to 3 days after her surgery and was back to work shortly thereafter.
All right, I'm giving it a double tie. There you go. Have a great day. And the surgery went off without a hitch. He was wonderful. He came to see me prior to me going under anesthesia, which I appreciate. And then we had to wait for the pathology to come back. Well, we would love to have your son come in and test here at Calvert School. I was just getting a little bit anxious and nervous and a little bit impatient, I guess I have to say. And it was on a Friday. And I remember that I had called his phone and I said, Dr. Mackey, I know that we're still waiting for the outcome of the pathology report, but if you could give me some indication from what you've heard just in a small text or a small bleep, I would really appreciate that, because I didn't want to have to go through the weekend to wait. And he just picked up on my need to really know, and it just happened to work out that the report came through the computer system, and he did give me a phone call and say, now, I don't normally do this with my patients, but because we had this kind of relationship and this type of thing, he did tell me over the phone. And that news was indeed good news, that the mask was a benign mask. I just think that in his mind, he said, I can make this woman have a wonderful weekend. I really can. And just that phone call meant so much to me. And for him to do that for me, it really just warmed my heart. The reality of life is that we are going to possibly confront things that we have no control over, and we have to trust and rely on the expertise of others to bring us through. I was in a situation that could have had a grave outcome. I trusted him and relied on him guiding me through, and he exceeded my expectations, and I'm thankful for it. I really am.
The Liver and Pancreas Center. Hope. At the University of Maryland, St. Joseph Medical Center.